Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health topics. And today we will talk about one of the most searched and most misunderstood topics in men's health, penis enlargement. I decided to talk about this topic because someone commented about penis enlargement pill to make his penis permanently big like a sausage. I'm glad that he asked me, a licensed medical doctor, about this instead of doing his own online research because there is a vast amount of misinformation online about this with products claims that often lack strong clinical evidence. In this video, I will walk you through what determines penile size from a medical standpoint, what methods have some scientific evidence, what methods are unsupported or potentially harmful, and what realistic expectations look like medically. I will also talk about pills. Before discussing enlargement, we need to clarify a few key anatomical and physiological concepts to make sure that we are talking with the same understanding in this video. First, erection process. The penis consists almost entirely of erectile tissues made of 3 columns of cords of sponge-like vascular spaces. Without sexual excitation, the erectile tissue contains little blood because the small blood vessels that supply these vascular chambers are constricted. So, the penis remains small and flaccid. During sexual arousal, these small blood vessels dilate, filling erectile tissue with blood, causing penis enlargement, making it more rigid and longer. These blood vessels' actions transform a small flaccid penis into a hard, long organ capable of penetrating the vagina. Next, suspensory ligament. The penis is anchored to the pubic bone by suspensory ligament, which plays a role in visible external length. And number 3 is stretch versus erect penile length. Clinically, penile size is measured in length and circumference of flaccid penis, stretched penis, and erect penis. Number 4 is measurement methods. There are different methods to measure the length and the circumference of the penis. Some studies about penis length use bone press measurement, where the ruler is pressed into the pubic fat pad to reduce variability caused by the body fat. Some studies measured from penopubic skin junction to the tip of the penis head instead. Some use rulers, some use measuring tapes, but many laymen use their feelings. This matters because many size concerns are actually due to measurement technique or body composition rather than true anatomical variation. So, what is normal size? According to 33 studies comprising more than 36,000 patients from different parts of the world, there is a wide range of normal size. Most men fall within a range that is statistically average, and importantly, perceived size concerns are far more common than clinically defined small penis conditions. This is the penis normal size, according to those studies. You can pause this video to read it at your own pace. A true medical condition called micropenis is rare and typically diagnosed in childhood based on standardized growth criteria, not adult perception. Now let's go through interventions that have some degree of clinical evidence. Number 1 is penile traction devices. Penile traction therapy applies mechanical stretching over time. Some patients may gain modest length increases this way. Traction therapy typically requires months, sometimes years of consistent use. It is commonly used in Peyronie's disease or post-surgical rehabilitation. However, because results are usually small or moderate over a long period of time, many patients did not appreciate their progress. So the compliance is challenging. Number 2 is vacuum erection devices. These devices increase blood flow temporarily, for example, in patients with erectile dysfunction, to help them getting adequate erection. Vacuuming has very limited role in true penile enlargement. They do not produce permanent enlargement, though temporary expansion occurs during use. Number three is surgical options. These come with the highest risk compared to the other techniques, yet outcomes are highly variable. That is why surgery is generally reserved for constructive or medically indicated cases. It is not a routine enhancement. Examples of penile surgery includes suspensory ligament release, fat grafting or dermal fillers, and implant insertion. Complications of penis enlargement surgery can include scarring, loss of stability during erection, or infection. Sometimes, cosmetic surgeries can exacerbate body dysmorphia, often masked as dissatisfaction with cosmetic outcomes, leading to never-ending cosmetic surgeries. Please note that these interventions will not make penis permanently big like a sausage. Once the excitement is over, usually after ejaculation, the sympathetic impulses cause vasoconstriction that reduce blood inflow to the penis. The muscle tone, cardiovascular, and respiratory activities returns to pre-arousal state. Patients using vacuum devices need to release the vacuum after the deed is done. So the penis becomes small and flaccid again. This is normal. The permanently big like a sausage is not normal. In fact, it is a medical emergency known as priapism. I won't talk further about it in this video. Kindly tell me in a comment if you'd like to know more about this condition so I can prepare a separate video about priapism. Okay, one of the most common questions I receive is,
can medications like sildenafil or tadalafil make my penis bigger?
the short answer is no. These medications do not permanently increase penile size. These drugs may make erections firmer, more reliable, and in some men make the penis appear larger because a fuller erection allows them to achieve their maximum original or normal erect size. Let's understand how these drugs work. When a man becomes sexually aroused, his nerve releases a signaling molecule called nitric oxide. Nitric oxide increases the production of another messenger called cyclic guaninosin monophosphate or CGMP that relaxes smooth muscle inside the penile arteries and erectile tissues, allowing increased blood flow into the penis, making it hard and rigid. Sildenafil and tadalafil belong to a class of medications called phosphodiesterase type 5 inhibitors, or PDE5 inhibitors for short. These medications do not create an erection. Instead, they prevent the breakdown of the CGMP, allowing the natural erection pathway to work more efficiently. In other words, they do not turn on the switch. Instead, they help keep the signal active once the body has already initiated the process through sexual stimulation. People mistakenly think these drugs enlarge the penis because many men with erectile dysfunction are unable to achieve their fullest natural erection. When treatment restores blood flow and erection quality, they may notice greater rigidity, improved erection duration, better expansion of the erectile tissue, and thus, overall, more confidence during sexual activity. As a result, the penis may appear larger than before treatment. But what has changed is erection quality, not the anatomical size. The medication has restored function, not enlargement. And allow me to warn you that PDE5 inhibitors are not for everyone. Even though they are generally safe when appropriately prescribed by medical professionals, these drugs have side effects resulting from blood vessel dilation elsewhere in the body. Common side effects include headache, facial flushing, nasal congestion, indigestion, and dizziness. Sildenafil may occasionally cause temporary visual disturbances, such as bluish color tinge. Tadalafil may be associated with muscle ache or back pain in some individuals. Rarely, this medication can cause serious side effects like sudden hearing loss, sudden vision loss, or priapism. People with certain conditions or undergoing specific treatments require individualized assessment by competent doctors because in some situations, PDE5 inhibitors can cause a dangerous drop in blood pressure. In addition to that, a proper medical assessment is important because erectile dysfunction can sometimes be an early warning sign of cardiovascular disease, hypertension, or diabetes. This is why self-medicating based on internet advice or anecdotal testimonies is never a good idea. Always, always consult your doctor personally if you have any medical issues. And remember, a man with a mild erectile dysfunction who regains a full erection with sildenafil or tadalafil might get the impression that his penis has become larger. In reality, he is simply reaching his normal physiological erection that he was previously unable to achieve. The medications do not enlarge his penis. Now let's talk about what does not work and the common myths. Number one is pills, supplements, and herbal products to enlarge the penis. There is no credible clinical evidence that oral supplements, pills, or herbal, or whatever can permanently increase penile size. There is no validated pharmacological pathway exists for permanent penis enlargement via supplements, pills, or herbs, or whatever. Many of those products are unregulated and may contain undisclosed ingredients. Some can be dangerous. Number two is penis exercises like jelqing and similar techniques. There is no high quality clinical evidence supporting permanent enlargement with these exercises. But they come with real potential risks of vascular injury, fibrosis, Peyronie disease or penile fracture, erectile dysfunction, etc. Number three is topical creams. They may cause temporary swelling or irritation, but no structural change in penile tissue. An important aspect that many people often overlook is perception versus reality. Many men underestimate their size due to comparison bias. Pornography exposure can distort expectations, and anxiety about size can contribute to sexual dysfunction. Many men who compare themselves to those porn actors will end up with disappointments. In some cases, clinicians evaluate for body dysmorphic disorder, where perceived defect is disproportionate to actual anatomy. This is a medical issue, not a cosmetic one. The problem lies up here, not down there. And patients may benefit from psychological support. You should consider medical consultation personally with your doctor if there is pain or curvature during erection and there is sudden change in penile shape or size. Then there is difficulty achieving or maintaining erection and severe distress about perceived size affecting your quality of life. Your urologist can evaluate both anatomical and functional concerns objectively. To summarize our talk today, most enlargement methods online are unsupported or exaggerated, and the methods supported by evidence, like the traction and surgery, have limited and variable outcomes. Medications like sildenafil or tadalafil do not enlarge penis, even though many men swear by it. Then perception and psychological factors often play a major role. The most important clinical message is this: there is no safe, simple, and dramatic way to permanently increase penile size beyond natural anatomical limits. Your optimal penis size is largely set even before you were born, just like your body height, your nose shape, eye color, etc. It may look small in little boys, but when you are normal and healthy, it will reach full size after puberty. A healthy penis depends on healthy blood vessels. The same conditions that affect the heart, for example, diabetes, smoking, hypertension, obesity, and unhealthy lifestyle, also affect erectile function. In many cases, improving overall health has a greater impact on erection size and sexual performance than any enlargement product ever could. That is my sharing today about penis enlargement. I hope you found this information useful. If you want to continue to get this kind of evidence-based health information, please like this video and subscribe. This will not only improve YouTube recommendations to better suit your preferences, but will also help me to share this info to more people. If you have any health-related questions, kindly type in a comment. We will discuss it in future videos. But please do not consult your personal health issues here. This is my disclaimer. Thank you for watching and see you in the next videos. Stay healthy and happy.